What if you could sit down once a week with a colleague who's a flat-out warrior? This colleague wasn't a stud in dental school. He struggled. He returned to practice in his hometown, an area once labeled by USA Today as the second worst place to live economically in the United States. And this very same colleague went on to establish an historically successful general practice known worldwide. What if you knew someone that wanted to take you by the hand and show you everything you need to know, from treatment planning to leadership, to maximizing your journey in dentistry, or just life? You ready to be inspired? Welcome to the Lionhearted.
Hi everyone, Dr. Steve Rasner here, and welcome back to the Lionhearted. I got multiple types of moods going on here tonight. If you're watching this, you can tell I look like crap, because I do, because I've worked so hard, more than I want to, in recent weeks. And I'm going to get into that. As you recall, the last two podcasts were common qualities of a lion-hearted dentist. And I'm going to have to, go in a different direction tonight because I'm ticked off, and I think I do my best podcast when I'm ticked off because I practice full time and things happen, especially at this stage of my career, that I think shouldn't happen, and I want to share them with you because they're teaching moments, and either you'll be able to relate to them, say, wow, that happens to me too, and tell you how I handle them. It's always a challenge, folks. It's never going to be just finally reach that space called nirvana and you never have to look back. To perform and put all of this together at the highest level takes persistence and relentless attention to detail. So we're going to call this, I'm going to come back to it in a minute, but you're going to love this. We're going to call this, I want you to think about this before I come back to it. The name of this podcast, and you could spin off on this as I go through it, that it's the same, it's another quality of a Lionheart dentist. The People in the Hallway. Real Stories by Stephen L. Rasner. People in the Hallway. I'm going to come back to that. I first want to tell you that this, I keep talking about it, but the 2023 live Lionhearted is getting more and more legs because I keep hearing from more and more of you, and actually globally, and it's exciting me and making me want to, like one of the guys responded very kindly. This particular doctor's a stud. I know that because he's been in one of my, several of my hands-on courses, and he didn't love the idea of me bringing in other speakers, and I wasn't sure how I felt, so I'm leaning towards me and then breakouts for my team with your team. So like my front desk staffers, from the people that make appointments to the people that take payments to the staff that has to respond to me, they're rolling all this. Certainly Michelle, the new patient coordinator, the person that's in that room, can you imagine what she could teach your new patient coordinator? And I mean really give her time. And Michelle, by the way, has done this with me years ago. I'm talking over 20 years ago when I first did my small United States tour. I did 4 cities. And she came with me, so did my team. We actually did this many years ago on the road. So I have all kinds of ideas that are gaining some strength because of feedback from you guys. And of course, you need to know, you need to bring your clinical team if you can. And we could do everything from even teach a course on the provisionals that we make, the temporary crowns. I mean, that's one little aspect of the whole thing. But I could give you a menu to choose from. So I don't want to go, I think you've listened to me for several years, and I've never really been one to I don't think, oversell stuff that I have to offer, but I do know this is a very strong goal of mine, and it's going to happen. And I'll give you plenty of notice as I get to a date. I want to tell you something else. I was getting mad at you guys because I thought you wanted to hear about the things I talk about, and you're so all over the map with when you download me or don't download me. I don't know, when you don't download, maybe I'm naive, but I'm thinking, oh, you listened and you tune out for a while. And look, I'm not going to hit it every week. This is hard to do. I'm going to hit it this week, I'll tell you that right now. But we're all my European friends except Germany and England. You're always there. And Ireland. Guyana is like my top 6th country. And the United States is real strong right now, too. So I love hearing from all of you, as you know. So, I don't know. It's what makes me tick. So, that's all the news about that kind of stuff. Let's get to some interesting talk for this week. The People in the Hallways, Real Stories by Stephen L. So, here's what's happening in my world. Maybe you can relate. So, let's say you are in a case, right? It could be Crown and Bridge. It could be a surgical case. And you're in that case for 3 hours. This is a really important thing that I want to talk about, not just on my podcast coming up, but in my live course as well. If you are on the road to being a super GP, which many of you are, you know what the disadvantage you have? If you're a super GP, it means you're doing advanced general dentistry treatments and specialty treatments as well. You may be doing complicated endodontics under a microscope, orthodontics, surgical procedures like eye favor. And you're really into it, right? And if you have, and you've worked, isn't it odd that we work all these years, you and I, and we measure our success by how many hygienists we can employ. But guess what? Those hygienists show up at your door because they have to. That's their job. You see, that's the difference, if any oral surgeons are listening right now, between you and I and my colleagues. We have a whole nother thing to figure out because you can't ignore all the hygiene patients. So it's not the basis of tonight, but I do have one form for you. And I've discussed it, I know, in other podcasts. And it's called the cheat sheet hygiene. So I have on Mondays and Wednesdays 3 hygienists that work for me. And on the top of each slip that they have is their own meme. Valerie, I think, is a dog of some sort. And it's just a quick way to identify which hygienist is dropping in this paper on my room wherever I am. So this is how this works. And to be quite honest with you, I learned this from Pete Dawson 30 years ago. And I'm surprised I never caught more traction. So it's not a big deal if you have 1, but if you have 2 coming or 3, you got to figure out how to minimize and become expeditious on what you're about to go visit and see, correct? I mean, think about this, guys. If I have 3 hygienists on Mondays and Wednesdays, and they see 6 patients a day, we know they see more than that. But let's say they see 6. That's 18 patients. If I spend 5 minutes each, what is that? 5 is 40, 130 minutes? Is that the math? It's a lot. So, wait, did I do that right? I don't know. It doesn't matter what I did. 5 times. No, that math's wrong. You don't have to cut that out, Josh. I'm exhausted. But my heart is going to say a lot in this podcast, so we're going to keep going. Whatever it is, it's a lot of time that you cannot calculate. Well, you can to get through your day. You don't know, and that's 5 minutes. You know it takes more. It takes a minute to get there, sit down, wash your hands, and get back. That's another minute. So what do you spend 3 minutes in that room? So it's really more than 5 minutes per hygiene visit. How are you navigating through that? How the hell can you do some of these surgical procedures that we are doing and handle what I just said? It's a real thing. So what I do is, number one, my staff has been alerted in those 3-hour visits I'm in that the hygienist don't bring me in for a routine exam. If that patient's 3 or 4 months, unless there's a big problem that you can't reschedule them for, do not come in my room. I'm sorry. If this sounds tyrannical, then it is. There's no other way to get through it. And certainly do not schedule something in hygiene. This is hard. I'm being honest with you. This is hard on the people that schedule your hygiene because they have to. Who cares that it's hard? I'm sorry. Life's hard. Doing what we all have a lot to gain from running this pinnacle type practice that does everything fine tuned. And part of that is not scheduling complicated, with a returning patient that you did extensive work on 5 years ago. For whatever reason, they fell off the map. Now they're back. Do you want that in the middle of a 3-hour crown and bridge visit or a 3-hour surgery? Well, that's got to be factored in. You got to go over that in your morning meeting. It's happened to me, and it's happened to me lately, and I went ballistic. You can't put a new patient exam against one of those. Yes, if you're doing routine mumbo jumbo type of dentistry, okay. I do get away with a lot because I would think it's fair to say to you that half my patients in treatment are sedated. So they really don't know if I'm there or not there. That's not nice, but it's true. I don't care. I still don't want to break my concentration of this. Don't put a giant insert in the middle of this is a lot to figure out. And if you're randomly just throwing together, and listen, we know what the hygienists are up against. Everybody wants to delay their hygiene. Everybody wants, it's not considered, it's a recall visit. Really, is that what it is? It's the most important visit to maintain your work is what it is. So we got to talk about that more because that's not really where I wanted to go. But I haven't even gotten to the people in the hallway. That's the people that come into my treatment rooms. And they're just doing their jobs. But I can feel my blood bursting through my veins when, for whatever reason, they're all there at that moment. And maybe I'm fumbling with a bone screw. And I'm sterile. And I'm intense. And, they get the back of my head going this. If you're not listening, if just listening to me right now, it's going left to right, like, no, I can't help you. So it really becomes incumbent on your hygiene schedulers. And it's hard, man. Because look, they got a 2 o'clock open, which is right in the middle of your big deal, right? And they've been trying everybody in the alphabet to fill that 2 o'clock. And they get somebody. Do you think they're all thinking when they finally get somebody to fill the last opening that what is doctor doing at that minute? It's a hard thing. And I'm not minimizing it, but it's got to be orchestrated like a symphony or you are not going to last long. So that brings me to my next point. If you don't delegate and teach, doctor, you'll crash and burn. I mean it. So even when I'm finished these 3 hours and I go, which is what I do, I go to my private office, which is located in my office right across from my front desk. And the door is always open 99% of the time. And I'll look up in the last couple months and it's like if you left a piece of candy on the driveway of your house. You ever see all these ants? And all of a sudden there's hundreds of ants. You can tell I'm mad this week. I'm comparing my staff to ants right now. I'm really not. I love my staff. They're at a Philadelphia Phillies baseball game tonight. I can't because I had too much to do. But that's what it feels like. I look up and there's one. Within a minute. I just sat down. I was gone for 3 hours. And I just sat down in my chair and there's one. And there's another. I'm not even kidding. And then there's 3 and maybe sometimes 4 at my door wanting something from me. That means I am failing in my delegating. You can make decisions without me. I'm not kidding. Or it's people forgetting protocols, people being staff, and letting you down. And that happened. It did. I've gotten to the point, and I know I'm saying it all tonight, and I'll probably lose some fans. But I'll look out there. Yesterday I had 2 3-hour back-to-back surgeries, which that wasn't a good idea either. But I haven't been in the office much, as you can see lately. I was in Portland, I was in Alaska, and that doesn't give you the right to jam me up. I never want to be jammed up, and you shouldn't be ever jammed up. You can't deliver your best when you're jammed. And then I go to take a break for like a minute, 5 minutes, have a cup of coffee, have a strong glass of vodka. I'm kidding. I wish I wasn't kidding, but I am. Something. Just relax. Just let me look at the birds outside for a minute. And there's 4 people there. And I found myself lately saying, whatever you're out there to ask me, it better be something that you can't answer yourself. Sorry for those words, guys. But I've spent enormous time with my team teaching them stuff. So if you don't delegate, if you don't take the time to say this, I'll give you an example. Years ago, I taught my front desk how to handle people on all kinds of situations, about the patient that lost their insurance and they still want to come to you, right? They call. It takes a lot of nerve to do that. I don't mean a lot of nerve like audacity. It takes a lot of humility to call your doctor and say, look, we've been patients for you. I have a family of 4. We still want to stay with you. Anyway, can you give us a break? And that sounds like old school stuff I did in the past. But I'm thinking of it right now in this moment as we're speaking. And my staff was instructed to, yes, they don't have to come to me to ask me that. That's what I mean by delegating. I taught them that. Somebody comes and disputes a bill. If it's under $200, just go with me for a minute. And my staff member at the front desk feels it's in our best interest and judgment because they know the case and they know the family. They have the ability up to $200 to adjust off. I don't care if you like that idea or not. I'm telling you, it worked for me for years. Whatever I did, whatever I have told you in the last 4 years, it's never been more evident that it was the right thing to run a practice than now. I could split me in 2 and double my production, which I assure you was pretty intense. I just don't have enough hands at this stage of my career, at 68 years old. And it came from all these things I'm doing, from people who lost their insurance. It still came to us. It's the worst thing you can say to a patient that wants an answer is, well, Sally's out this week. I'll give it to her next week when she gets in. And then, God forbid, Sally forgets the next week. And it's the same thing when people call you with a problem in their mouth. Not getting back to them so I have a protocol for that. My office knows that what to do, how to research the chart. I'm talking to front desk. It's a protocol. I wrote a protocol book. You know about it. Some of you have asked for it. I've sent it to you for free. I used to charge $180 for it. You don't get the actual book anymore. You get the typed version that it's been transferred in. And that's where a lot of these protocols came from. But that's what I mean as an example when I tell you about delegating. So in the past week, I noticed that some of my mid-level assistants, so not my primary 2 or 3, I have 3, under them, they work with associates. Sometimes they work with me as a third. I noticed that 2 people had to come in to have temporary crowns re-cemented. And I don't even like that word, by the way, re-cemented. That means it came out. My temporary crowns don't usually come out. So it bothered me to begin with that it came out. But I noticed on these 2 patients, they happened to come out more than once. And there's reasons for it. One's waiting for an implant. One's waiting for an implant to integrate. It's already in her mouth, so she has a cantilever off a crown holding space so she didn't have to wear a removable. I'm sure you've done that before. And it's not the way I would design a normal prosthesis, but it's okay for the 4 months while the implant is integrating. And I didn't want to load the implant. It was number 6. And so I noticed that both patients that had lost temporaries who came into our office as emergencies, that's what I was alluding to a few minutes ago. So when that call comes in, we have to screen it. We, as in my front desk, go to a clinic member, take the schedule with you, see where it fits in. If it does, if it's a posterior tooth with a root canal, I got protocols for every kind of tooth you can think of. Then no, they don't have to come in that day. If it's a driver patient, you know what they are. They want everything done yesterday. They probably get it that day. If it's a front tooth in the aesthetic zone, they probably get it that day. And meaning get it, they get their temporary back. You know, because it's not good marketing at the place they work at when they're walking around missing number 7. Oh, who do you go to? Dr. Rasner. You mean the great Dr. Rasner? That's what he does? So it's pretty important. But they got them in that day. And if it's come out more than once, that seems like a problem to me. So I've delegated to I've taught them to strategize, just like I do with my extractions. And I teach my docs that. I don't know what dockers are, but I teach my doctors that what's going on here? Is it the bite? Does it need a new temporary for whatever reason? You know, is it bone dry when you put the temporary back on with cement? How long until the permanent one gets here? It's just not slam dunk. There's your tooth back. Thank you. Because that makes it worse for me if it's not really re-cemented at the protocol I would do. You understand what I mean when I tell you about delegating? That's what I'm saying. And I felt my office is just missing all that. So I called a little meeting and I gave this kind of talk that I'm giving to you. And when you give a talk like that, you can't be Dr. Wussy. This podcast is either going to bury me or make some fans. You can't be Dr. Softy. You got to say the way it is. You don't have to yell. You have to be clear and convicted in your feelings. And so I did. And I also said, listen, right now as I'm talking to you, and I'm talking just like this, and I'm giving them examples that I just gave you about the temporaries and about executing what you've been delegated and taught. Instead of coming to me every time you see me walk by, instead of reading the chart and really doing diligence to what you know how to do. And I said, if what I am saying to you bothers you, if you think this is mean, if you think oh my God, this is so hard here, then you're probably in the wrong place. You're probably not in the right place. Guys and ladies, doctors, staff, if you want to perform as a Super Bowl champion, or whatever analogy you want to make, it's not an accident. It's the execution of excellence on every level. Front desk team to sterilization person that turns over rooms. If your person that turns over the rooms thinks it's okay, like mine does occasionally lately, to leave something on the floor like a Q-tip or anything, then it's a lack of leadership by you. And you got to be crystal clear with what you expect. You do. And I'm not telling you to go out there and start firing people. I'm telling you, people need to know how we work around here and what is okay, what is not okay. So all the people in the hallways, hence the title of my podcast, are those people that I'm referring to. They're the people that have been taught things for years. For whatever reason, in the last 3 months, there's so much I just said to you, especially the scheduling thing, because I know that affects all of us, right? I know about what I'm talking about. When you're involved in a serious, there's so many situations. You could be simply cementing, I say simply, 8 veneers. You want to be interrupted when that happens? Well, whoever's scheduling hygiene, if you're a GP, has to take that into consideration. And they're not even thinking like that half the time. Because it's hard filling hygiene. It's not hard filling hygiene, I know, since COVID. I get it. The problem is in a lot of practices, and even mine at times, it's hard to get, you're not going to call 24 people for 3 hygienists on Tuesday for Wednesday schedule, and they're all just going to say, I'll be there. And maybe 16, 18 will say that. But somebody always has a change of plans. They're not scheduled for, a heart transplant at your house, at your office. Am I right? And people think nothing of changing that visit. And they'll think less of changing that visit if you minimize how important, which I never do. One of the first things I would teach a Lionhearted dentist is to tell their patients in those 5 areas that we examine: the periodontium, health of the periodontium, the health of all the teeth, health of the joints and muscles, missing teeth, and aesthetics. There's a reason the health of the periodontium is the first one I mentioned, because it should be. And I will tell you, in a great Lionhearted practice, most of those patients have healthy periodontium. If you don't hesitate to rescale and root plane them because they had it done a year ago, and they fell off the wagon, or redo a gingivitis scaling, just because, I don't want to tell them that. They just had that done a year and a half ago. So what? Are you a doctor, hygienist? Are you diagnosing or not? You either have healthy gums and bone, or you don't. And it's not your job. It's your job to educate them. Are they on 3 and 4? How many patients do we have to put their arm behind their back to get them to keep their 3 and 4 month recalls? And I tell them that. I said in the beginning, I do. All these things, guys. If you're watching me right now, I'm holding my head from the tension. All these things came from years of not doing it and having the consequences. So when I recommend and scale root plane a patient, I say, I got to tell you one more thing. This isn't like one time and you're done. It could be if you have minimal damage at this point. And so the conversation's appropriate to who I'm talking to. But let's say it's a patient with 50% bone loss, 60%. I said, most patients fall off the wagon, and asking you to come every 3 or 4 months, trust me, is going to come around quickly. And you're going to have an urge. You're not going to feel pain because it often does not hurt. And you're going to think you're okay. And by the way, insurance only covers 2 of these a year. They get that talk from me in the beginning. And I document. We got a lot to talk about, don't we? I'm just off on a whim tonight because it started with people in the hallways, and now I'm talking about that stuff. Last couple things I'll leave you with, and maybe I'll pick up on this next week. Being too busy is a real thing. And it's not the way of the Lionhearted dentist. You got to be just like an athlete, in control, calm, not frenetic. I don't know what room to go to right now. That's no good. And you always have to be motivated when you're telling a patient something about what is right. I had a patient today come in to see me, and I'll lead with this next week, that had 3 implants placed by an oral surgeon, and he was coming to me to restore them. They weren't uncovered, by the way. And I told him that's the last thing I would do. And they were flabbergasted because they spent all this money a year ago for 3 implants. This kid, when I say kid, he's in his 40s, has complete collapsed vertical dimension of occlusion. He's missing molars everywhere. He's worn down 6 through 12 by half the original incisal length, including the linguals. He's going to start to splay or break teeth off. It was out of order. It wasn't my recommendation. I gave him a recommendation 2 years ago, and it just didn't come back. I don't get everybody. I'm going to leave you with this. This stuff works, man. Not kidding. Think about what I said 10 minutes ago. I could split myself into 2 Steve Rasners, and I would double my production if I could have the other Steve Rasner be as sincere and earnest with new patients. That's how much work comes from people trusting you. From people, they should trust me. And if you follow my principles, they're going to trust you. And trust is more important than your fees. Trust is more important than having average to low fees. Way more important in terms of you being busy. Everybody that comes to me goes out of network. Do you hear me? So they get less, but they get excellent care, and they get honorable care. I had a woman in my chair today that just didn't like her partial, and my assistants had adjusted it 5 times, and she wanted to see me personally for this post-adjustment. It was beautiful. It couldn't fit any better. But I think she's got an allergy to the metal, and I'm making her a new one. I wouldn't even dream of not. The cost of business in being a high-end dentist that people can trust is you got to be honorable about everything. I hope this helped. I know I was off on some crazy, emotions tonight, but I like when I'm like this with you. I work today, and that's the best time for me to do these podcasts. So I appreciate you all. I really do. I love hearing more and more of you writing to me lately, and some things are just beautiful, and it makes me very happy. It makes me feel this is worth it. See you next week, guys. Let's do this. We only have, 3 months left? Yeah. Let's finish strong. See you next week on Lionhearted.